Understanding female ejaculation. What is squirting and how it happens? Female ejaculation, often called squirting, is a topic that has gained attention in both popular culture and sexual health discussions. While it's sometimes shrouded in mystery or misunderstanding, squirting is a natural phenomenon for some women and people with vulvas. This article explores what squirting is, its physiological basis, and how partners can approach it with respect, communication, and care. What is squirting? Squirting refers to the release of a fluid from the urethra during sexual arousal or orgasm in some women or people with vulvas. This fluid is distinct from vaginal lubrication, which is produced by the vaginal walls and Bartholin's glands during arousal. Squirting is often associated with intense sexual stimulation, particularly of the G-spot, though it doesn't happen for everyone and isn't a universal experience. Key points about the fluid. Composition. Studies, such as a 2014 analysis in the Journal of Sexual Medicine, suggest the fluid is primarily a mix of urine, due to its release from the urethra, and a small amount of prostate-specific antigen, PSA, a substance produced by the Skene's glands, sometimes called the female prostate. The fluid is typically clear or slightly milky and odorless. Volume. The amount varies widely, from a few drops to several ounces, depending on the individual and stimulation. Prevalence. Research estimates tend for 50% of women may experience some form of ejaculation, though not all describe it as squirting. A 2017 study in Sexual Medicine Reviews noted variability in experiences, with cultural and psychological factors influencing awareness and comfort. Squirting is not a measure of sexual satisfaction or performance. It's one of many ways bodies respond to pleasure, and its absence doesn't indicate a lack of enjoyment. The anatomy behind squirting. Squirting is linked to the anatomy of the pelvic region. Skene's glands, located near the urethra. These glands are thought to produce the non-urine component of ejaculate. Their size and functionality vary between individuals, which may explain why not all women squirt. G-spot. The G-spot, a sensitive area on the front vaginal wall about 2 to 3 inches inside, is often associated with squirting. Stimulation of this area, which is close to the urethra and Skene's glands, can trigger fluid release. Pelvic floor muscles. These muscles, which support the bladder and uterus, play a role in orgasm and ejaculation. Strong or relaxed pelvic floor muscles can influence the intensity of the experience. The process often involves a buildup of arousal, pressure in the pelvic area, and a release that may feel like a sudden gush or trickle during climax or high arousal. How to facilitate squirting, a guide for partners. Squirting is not something that can be forced or guaranteed, as it depends on individual anatomy, comfort, and arousal. However, partners can create an environment that supports the possibility. Communication, patience, and mutual respect are essential. Here's how to approach it. Prioritize open communication. Discuss desires and boundaries beforehand. Ask your partner if they're curious about squirting or have experienced it. Some may feel self-conscious due to myths, e.g., that it's messy or urine. Reassure them that all responses are normal. Check in during intimacy to ensure comfort. Phrases like, "Does this feel good?" or "Let me know what you like," foster trust. Create a relaxed environment. Ensure privacy and minimize distractions. A calm setting helps your partner feel safe and focused on pleasure. Use towels or waterproof bedding to reduce worry about potential fluid. This can ease anxiety about making a mess. Encourage your partner to empty their bladder beforehand to reduce concerns about the sensation feeling like needing to urinate. Focus on arousal and foreplay. Squirting often requires high levels of arousal. Spend time on activities your partner enjoys, such as kissing, touching, or oral stimulation. Use lubricant to enhance comfort, especially for prolonged stimulation. Water-based or silicone-based lubes are safe for most activities. Explore erogenous zones like the clitoris, nipples, or inner thighs to build arousal before focusing on the G-spot. Stimulate the G-spot. Locate the G-spot. Insert 1 or 2 fingers into the vagina, palm up, and make a come-hither motion toward the front vaginal wall. The G-spot feels slightly textured or spongy compared to surrounding tissue. Apply gentle pressure. Start with light, rhythmic pressure, adjusting based on your partner's feedback. Some prefer a faster or firmer motion as arousal builds. Use toys. G-spot specific vibrators or curved dildos can target the area effectively. Ensure toys are body safe, e.g., made of silicone and cleaned properly. Be patient. It may take time for the G-spot to become responsive. and squirting may not happen every time or at all. Encourage relaxation during the urge. As arousal intensifies, your partner may feel a sensation like needing to urinate. This is often a sign of potential ejaculation. Encourage them to relax and let go rather than tensing up. Avoid pressuring them to squirt, as this can create stress and reduce pleasure. Let the experience unfold naturally. Explore other techniques. Clitoral stimulation. Combine G-spot stimulation with clitoral touch or a vibrator, as dual stimulation can heighten arousal. Pelvic floor exercises. Some women find that practicing Kegel exercises, contracting and relaxing pelvic floor muscles, enhances sensitivity and control. Vary positions. Positions like missionary with legs raised or doggy style can make G-spot stimulation easier. Celebrate all outcomes. Whether squirting happens or not, affirm your partner's pleasure and experience. Pressure to perform can detract from intimacy. If squirting occurs, reassure your partner that any fluid is normal and part of the experience. If it doesn't, focus on the connection and enjoyment shared. Common myths and misconceptions. Myth: squirting is always urine. Reality: the fluid is a mix, primarily dilute urine with traces of PSA. This doesn't diminish its validity as a sexual response. Myth: every woman can squirt. Reality: anatomical differences mean not all women will experience it, and that's normal. Myth: squirting equals better sex. Reality: it's just one possible response, not a benchmark for satisfaction. Myth: squirting is always dramatic. Reality: it can be subtle, a trickle, or more pronounced, varying by person and moment. Health and safety considerations. Hygiene: wash hands, toys, and any surfaces to prevent infections. Use condoms or barriers for shared toys. Consent: always ensure enthusiastic consent for all activities. Stop if your partner expresses discomfort. Hydration: squirting can involve fluid loss, so staying hydrated is helpful. Pelvic health: if G-spot stimulation causes pain or discomfort, consult a healthcare provider or pelvic floor therapist to rule out issues like pelvic floor dysfunction. Emotional and psychological aspects. Squirting can carry emotional weight due to societal stigma or personal expectations. Some women feel empowered by it, while others may feel shy or embarrassed. Partners should normalize the experience by discussing it openly and non-judgmentally. Avoid fetishizing or overemphasizing squirting, as this can create pressure. Focus on mutual pleasure and connection, not a specific outcome. Conclusion: squirting is a fascinating and natural aspect of female sexuality for some, rooted in the complex interplay of anatomy, arousal, and relaxation. While not every woman will experience it, those curious can explore it through communication, patience, and G-spot focused techniques. The key is to prioritize pleasure, consent, and mutual respect, celebrating the body's responses without judgment. By fostering a supportive and open environment, partners can deepen intimacy and enjoy the journey, whether squirting happens or not. For further reading, consider resources from sexual health organizations like Planned Parenthood or books like Come As You Are by Emily Nagoski, which explore female sexuality with science and empathy, by Scott Young, aka Sinfamous Gamer.